Welcome to Mededia. This is Umar Tariq. So today we will be doing a mock interview of one of our Mededia interns, Dr. Sara Shahid, who's a residency applicant. Hi, Dr. Sara Shahid. How are you doing? I'm Dr. Umar Tariq.
Hi, Dr. Umar Tariq. I'm doing very well. How are you?
Good, good. Tell me a little bit about yourself.
So I'm Sara Shahid, and I grew up in Pakistan. And I also went to medical school in Pakistan. I was the first physician in my entire family, and I was always very passionate about becoming a doctor. When I was in medical school, I became very interested in internal medicine because of the diverse nature of internal medicine and how it's connected with a medical and a social cause, and that is something that really resonates with me. And you get to see such a wide variety of diseases, so I was always very fascinated with internal medicine. And I applied to US because it's the best place to train, and because of seeing patients in Pakistan and in US, I've seen a wide variety of patients, and there is a lot of diversity in my medical training. In my spare time, I like to read books, and I'm very passionate about reading. I usually pick up memoirs of different people that I find interesting. And I'm also very interested in teaching. So I recently did a career counseling internship with Mededia, which is a career counseling platform. And I was very interested in that. And currently, I'm doing an observership in an internal medicine clinic. And I'm also doing research with the University of Kansas in their hematology oncology department.
Thank you. Thank you very much. So you said you get impressed. You get really impressed by reading memoirs, right?
Yes, that's correct.
So which one was the one of the most fascinating ones that you've ever read?
So recently, I read a memoir by a neurosurgeon doctor, Paul Kalinithi, and it was published posthumously. It goes by the name of When Breath Becomes Air. So it was a very motivating memoir that I read, and it was something that I found very interesting. And apart from that, I read a memoir by Matthew McConaughey. It goes by the name of Green Lights. So that was also a very interesting one.
So what was interesting about them? What was so
Um,
unique about both these memoirs?
both these. So normally I usually like gravitate towards memoirs, which is about people, who have faced hardships and how they overcame it. So I find that very motivating for myself as well. In the memoir about the neurosurgeon doctor, it was that he was in his residency and he got diagnosed with metastatic lung cancer, which was very advanced. So it was so fascinating and motivating for me to read about him and his life, and how he was, even in the face of such a big calamity, he was still moving forward with his life, and he still wanted to finish his neurosurgery residency. So that was something that was very intriguing for me and motivating.
It's pretty impressive. And about the other book?
And in Green Lights, this is about the famous actor, celebrity actor
Sure.
Matthew McConaughey. So it was more about how he got involved in with acting and how he was introduced to this industry, and the hardships that he faced and how he overcame it, and just an insight about his life and how he takes everything. So that was another perspective that I got, and that was also very interesting.
Interesting. So do you buy these PDF books, or you buy the real books, or you listen to them on audiobooks?
Yeah, so I don't like to read it like on the audiobooks, or don't like to listen to that. I usually like to go to like a bookshop and pick them out, and I
Wow.
like
Wow.
it like a hardcover book.
Nice, nice. A lot of people do that. So um, uh, tell us that what are your three biggest strengths?
So the first strength that I think is very important is that I've had a lot of diversity in my medical training. So in Pakistan, there was a lot of focus on clinical skills, and in US, there was focus on evidence-based medicine. So I got a taste of both kinds of patients, and it brought a lot of diversity to my training. Apart from that, I am very dynamic. So I have involved myself in clinical work, and I like to do a lot of research, and I like to teach. So I have involved myself in various teaching activities like my Mededia internship. Um, and I'm an excellent team player. So I find I love to be a part of a team, and I'm very friendly and approachable. So it's very easy for me to be a part of the team, and I have excellent leadership skills. So I led a team from Pakistan to an international competition in the US at NASA. So
Yeah, I was going to
these
ask
are
you
all
about
the,
it. Sorry, I was going to
sorry.
ask you about it, that I read that in your personal statement. So tell me more about that. How did you represent your country uh, to NASA?
So it was, I was actually elected as the science president in the student council of my school. So it was my job to, pick out different competitions. And this was one of the competitions that I was very interested in. And I made a team, and we represented first in New Delhi in India. And then we had an Asian regional competition over there, out of which my team was selected. And we came to Houston at NASA to for a space settlement design competition that's held every year. So it was a very big achievement for me and my team as well. And it was a great opportunity for all of us to come over here, and we got to represent the entire Asia region.
Very impressive. Very impressive. So shifting gears, tell me y- if you have to tell me your three weaknesses, what would that be?
So I think that I overwork myself a lot. I'm very interested in clinical work and research and teaching activities. So sometimes I think that I don't get enough time for my hobbies or for my family. The second would be that I'm very meticulous in my work. So even in Pakistan, because of lack of funds and lack of resources, uh, uh, I did a very thorough physical exam. And when I entered the US system, it used to take a lot of time. But I overcame that weakness of mine. And then I started to do a very comprehensive and a succinct physical exam so that I could do it in an effective time, in an effectively with my time. Um, and the third would be that I tend to self-criticize a lot. Um, but it's because I believe that you are your own biggest critic. So I think that I'm very hard on myself.
Okay, all right. And so you said you're pretty busy with your commitments and don't get enough time for your family. So do you think you would be able to give enough time to the residency training?
Yes, I do think that because I am fully prepared and fully focused to enter for my medical residency training, so I am going to be very focused on this right now.
Okay.
That
So tell me, when did you graduate?
I graduated in 2014.
2014. And so what have you done since then in your time since
Uh,
graduation?
yes. So after I graduated, I started doing some clinical work with a clinic. It was a Munir specialist clinic, and I was working with Dr. Iqbal. After that, I started also studying for my USMLE Step 1 and Step 2 exams simultaneously. And throughout these years, I have tried to stay clinically active by, working in various clinics in Pakistan. And after I moved to the US, I also did some observerships and got some US clinical experience over here as well.
Okay. Tell me, what has been your biggest challenge after med school that you encountered in the past 6, 7 years?
So the biggest challenge I would say would be how you effectively manage time and how you how to achieve all of your goals. I think that that has been my biggest challenge.
Okay. All right. Share an interesting case that you encountered.
So I was recently doing an observership with the nephrology department, and we saw a very interesting patient. We also got to write a case report on it. So it was actually a 53-year-old female who presented with dyspnea and with swelling around her ankles. And on her physical exam, she had peripheral edema and she had crackles on her chest. Um, and she um, so we followed her up with labs, and her P anchor was positive and her MPO was also positive. And her serum creatinine was significantly elevated. So the same patient had actually presented 8 months prior to this admission, and with dyspnea, and her P anchors and her MPO was positive at that time, but it wasn't addressed. And she was discharged on just some antibiotics after an infectious disease workup. So this case was very interesting because we got to interpret how sometimes ANCA positivity is not interpreted properly in the clinical context. And it was a very enlightening case in that sense.
So, what was your diagnosis?
So the female actually had MPO positive vasculitis, uh, but initially, since her P anchor positivity was not addressed properly, because she seemed to do better with antibiotics. Um, her P anchors were positive, and it was important to follow up and be more vigilant about her symptoms. Eventually, this patient was put on dialysis, like because after a renal biopsy, her kidney functions were completely gone. So she was put on long-term dialysis, and she was an end-stage renal disease patient.
Did she get better after that, or she got worse
After
after the treatment that you guys provided?
So she did improve slightly, but it was the case was interesting because we got to see how important it is to interpret ANCA positivity in the correct clinical setting. Some of the patients, they don't have any symptoms, but some of them have end organ damage. So it's important to kind of follow them up, and this was kind of like a quality improvement project that
Okay.
it could be used like that.
Interesting. Thanks for sharing. So, share a situation with us when your presence was able to make a significant difference. Let's say there was a case being managed, you came up with a brilliant idea, or anything. You were doing a project. Doesn't have to be medicine, but anywhere, anything that you think you were able to contribute significantly, and your presence made a significant difference to the entire project that you were working on.
When I was the team leader at NASA, there were many different conflicts, like personal conflicts and technical conflicts between the various departments. And since I was the team leader, it was my task to resolve all these conflicts. And that was a very challenging situation because it was a very big competition, and there were people from various countries, and so there was bound to be some kind of conflicts. And I thought that in my position was to resolve those conflicts and delegate tasks and assign tasks, and that was something that I was very good at, and I was able to manage everything effectively.
Okay. So tell me a little bit about your family. Do you have a family?
Yes. So I have a family. I have two kids. My son, he is 6 years old and he goes to school. And my daughter, she's 2 years old.
All right. So when you get a residency, I'm assuming your husband, is he going to relocate with you or he's going to stay wherever he is?
No, my husband, he's going to relocate with all of us.
Okay. So you don't have any strong geographical preference. Wherever you match, he will come with you.
Yes, that's correct.
Okay. So with your two kids, do you think you will be able to give enough time to your family if you join for residency training? You will be working anywhere between 60 to 80 hours per week.
Yes, so I'm well aware of the working hours of residency, and both of my kids, they are very independent now. My son, he goes to school, and my daughter goes to daycare, and I have a lot of support at home. So right now, my priority is going to be my residency training, and I believe that I have the support from my family and from my kids, and I'm going to be very focused on my training.
Good. Thank you. Okay. So why do you want to come to this program, this specific program? Why do you want to come to us?
This program is one of my top choices because this provides the best clinical training that I'm looking for, and I'm very interested in the camaraderie and the collegial environment that this program offers. That's why I'm very interested in this program.
Okay. So what will you bring unique to this program that others cannot? What's unique about you? Why should we hire you?
So I believe that the diversity in my medical training is going to be a quality that I bring to the program. And my training in Pakistan has taught me very good clinical bedside skills. And that is something that I'm going to offer, and that usually translates to cost-effective patient management and patient care.
Okay. So let me ask you this. If you are by yourself on an island, right, and you're only allowed to take three things with you, what would those three things be?
Um, I would I would take my phone with me because I
Okay.
think that would be a source of communication with the rest of my family. And the other thing I would take would be um, uh, let me see. So, can you please repeat your question? Like, you mean
So if
just
you're
things
buying,
that I could take?
sure, yeah, if you're going by yourself, getting stranded on an island for a month or something like that, what three things you would like to take with you and why?
Okay. So yeah, so one would be my phone so that I can stay in touch with my family.
Okay.
The other thing I would take would be a book to read because if I'm getting bored, I would like to have some source of entertainment. And the third thing would be uh, my stationary bike because I am very interested in doing that, and that's something I do every day.
Okay. Yeah. So tell me, what's your favorite thing about your father, your dad?
My favorite thing about my father would be that he is a very optimistic and a very positive person, and that is something that he has taught us as well. and the way that he faces challenging situations and he rises up to the occasion is something that I really look up to.
And tell us about, let's say, a couple or three things that you don't like about your father.
Um, Things that I don't like about my father would be that I really have to think hard on this one.
Of course, take your time.
Uh, so he is, I think that he trusts people very easily, and
Okay.
I think that he should uh, take his time to trust other people.
Okay. Anything else?
The other thing would be that he is, uh, I think that he is, his optimistic nature is a very good thing, but at the same time, it's also dangerous because sometimes he tends to overlook situations where he needs to be some situations that he needs to be aware of. He tends to overlook those because of his optimistic nature.
Okay. Tell me similarly a couple of weaknesses or shortcomings that you don't like about your mom.
My mother is actually, I would say that she tends to get, very paranoid, and she has this tendency to get upset very easily.
Okay. Anything else?
And the other thing would be that my mother, uh, think, um, uh, I think that she has hmm, she has a tendency to um
It's okay. It's
uh,
okay. If you can't think of it,
yeah,
that's fine. That's fine. So you
yeah.
mentioned a couple of shortcomings about your father, one about your mother, that she sometimes gets a little paranoid and becomes a little frustrated easily. So which of the shortcomings of your parents out of these have you inherited from them?
um I think that I've inherited um my father's nature of being overly optimistic sometimes.
Okay. All right. Do you have any questions about the area, the program, or anything for me?
Um, yes, so I have a question regarding the program.
Mhm.
I would like to ask that uh, what what is the work-life balance that is usually seen at the program?
So we have pretty good work-life balance. We have a lot of trainees who are married, who have significant others, who have kids, and I think the residents do a very good job supporting each other, especially if somebody gets sick or if they have a child who's sick. They do pretty good. But at the same time, we are a residency program, and we expect you to work hard, study hard, give your best time. And yes, we will be busy sometimes, especially when you're on ICU rotations. You'll be working a lot of hours, long hours, weekends, and on holidays. So be prepared for that, but at the same time, I think our work-life balance is pretty decent. Our residents, they organize a lot of out of the hospital, recreational activities. Yeah, so I think we do pretty good in that regard. But at the same time, it's not like just a recreational training program. We work hard. We make sure our first priority is to make sure that you, as a physician, you're well trained. But at the same time, we don't want to overwork you. So we try to maintain that fine balance.
Yeah, thank you so much for answering
Welcome.
that.
Any other questions from me?
No, thank you so much.
Okay. Well, thank you, Dr. Shahid. It was very nice meeting you, and good luck for your interviews.
Thank you so much. Same here.
Thanks. Bye. All right. So coming about feedback. So very good job. Good job. It's just, so let me tell you one thing. I did a bunch of interviews, right? As a trainee myself, as a fellow for research fellowship, and like other for jobs as well. I'll tell you, this was purposely designed to be the toughest interview that I encountered. I didn't ask you one question that I wasn't asked. The most
Okay.
challenging interview that I had was the one in which the interviewer asked me these last 4 or 5 questions, which I had no idea on
Yeah.
why he would ask me this, right? So I purposely, I initially started with the typical questions that you prepare for,
Yeah,
but at the same time, be prepared that sometimes there might be
exactly.
someone who will come. So I was in the exact same situation that you were on, and that he was asking me these questions, and I'm like, why on earth? I eventually matched into that program. I became a very good friend with the attending, and I asked him, why did you ask me these questions? Like, being stranded by yourself in an island, what items would you need? What are your
Oh,
the bad
yeah.
things about your parents that you
Like
don't like? And then
you
which one of which one of those you inherited?
you're just really thrown off. So
Right, exactly. He said, I want to see how you react when you're placed in a difficult situation. And the way a lot of programs structure these interviews is like, one, he's like super easy. He's not even asking you questions. He won't even let you speak. Like I had few interviews in which they were doing is selling me the program without asking me any questions, or and like
mm,
I'm like I didn't get any chance to express myself. There are programs
mm,
like that. They have like, okay, there are 3 or 4 people who are going to interview you. How about you just focus on the recreational part, the extracurricular part, or selling the program? How about you just grill the person? You see how he will react in a stressful situation.
mm,
How about you get to know the applicant? So this is
mhm.
how this specific program was designed. And I was like, there is this person who was just asking me questions and trying to, and then there was this person who was purposely asking me very stressful questions that I had no clue how to answer them. And then there was this third person who didn't even let me speak. All he was doing me was like telling me about the area and the program. So be ready for that, right?
Okay.
Like be
Yeah.
prepared that they could ask you any silly question, and whenever that happens, it's like, oh, interesting question. I'll take a minute to think about it, or
Hmm.
so stuff like that. Second, so see, this is the most challenging interview that you most likely will encounter. You will not encounter typically an interview that will be this challenging. I started off easy with the typical questions, and then I gave you the challenging questions because I wanted you to see yourself how you reacted in those
Hmm.
scenarios. It truly doesn't matter what you answer. What it matters is how you react to the situation.
Okay.
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 And one more thing that I will add is that the reason he said he asked me the island question was that he wanted to see if I'm a high maintenance person versus a low maintenance person. I don't know how that makes any sense. He wanted to see if I was like, no, I need more stuff, I need some high end stuff. He wanted to see that, so that's why he asked me that question. And then the other question was about the parents. He's like, I want to see if you say, oh, no, 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 I absolutely didn't, not, I have a lot of bad things to say about my parents, and I did not inherit any of those bad stuff, that means you're not an honest person, right? So that's why he was asking me these questions. But you never think like that. When you're in the middle of an interview, you're
Yeah.
like, what? Oh, why are you even asking me these questions? Okay. So now let me see the pointers I got. Okay. So see, when somebody asks you, if there is one question that you have to
Hmm.
prepare for your
Okay.
interviews, one question that has to be, tell me about yourself,
ठीक है.
right? So you need to prepare well for that question. You don't start with, my name is Dr. Sara Shahid. They know what
Okay.
your name is. Most of the times
Hmm.
they will also know which country you're coming from. Are you from
ठीक
Pakistan,
है.
or whatever? So you don't need to tell them that, okay, well, this is my
Okay.
name. Second is, see, there are a lot of typical
Okay.
questions that everybody will ask you on almost every single interview. Tell me about yourself, your 3 biggest strengths, your 3 weaknesses,
Hmm.
um, you know your biggest challenge, share an interesting case, share a situation where your presence made a difference, why you want to come to this program, what's so unique about you, why should we hire you. So when you have when you're preparing for your residency interviews, make sure you have some idea of what you're going to say when you're asked these questions.
ठीक
Okay,
है.
so even for your personal statement, anything that you mention in your personal statement, like, your specific situation was NASA, or what's unique about you, you say that all the time, that your time since graduation has been more. So make sure you have good answers for
Hmm.
those, right? And there's nothing wrong with saying that I had 2 kids, I was raising my family, and now my kids are going to school, I have a lot of free time, and I think I can devote enough time to my own profession. There's nothing wrong with it, and there's nothing like a lot of people take time off for other reasons, research or pursuing another profession or family reasons. So don't be embarrassed about it. That's okay. But at the same time, I'll say prepare the answers to these questions. You can do more mock interviews, or at least can get some okay, or at least get some idea of what you're going to say if somebody asks you this. Second thing, just because this happens to be an interview then which I'm asking you questions, you don't have to mention Mededia. I don't know if you were mentioning you will mention Mededia
No,
in all
I
your
heard
residence.
that जो ये career counseling को they really like to hear about that in one of the interview questions.
Sure.
So मैंने कहा कि उसको डाल देती हूँ.
Sure. So if you do that, keep in mind that this is also one more thing very important. Don't mention names. Like you work with Dr. Tariq, you work with Mededia, you can mention names, but what's more important is what is Mededia, or who was the doctor you were working with. I worked with this nephrologist. Then you mention the name. When you're telling me I work with Dr. Tariq, Dr. Moni, I don't know who that person is, right? So you need to tell me, okay, I work with this nephrologist, I work with this interventional radiologist, whatever. And then let's see what else I have for you. Yeah, names don't matter. And you need to, so one more, I think you did pretty good answering your questions. The confidence level was good. You need to have a good confidence level. You need to, anytime you come across a question that you didn't prepare for, keep in mind there is a reason they're asking you this question. The content of your answer probably doesn't matter that much as compared to the confidence with which you're answering it, or how you reacted to that. Do we have that long awkward silences, or you're just saying something to think on your toes, and so that's that. A couple of things about your setup for interview. What I would suggest is, like, for your interviews, just go an extra mile. The problem is when you go in person for your interviews, you're being judged on a lot of different things, right? You don't have that. Now all we have is like 10-15 minutes, so you got to impress them in those 10-15 minutes. A couple of things you can read about, or Google search or YouTube search, that how to do well in your video presentations or interviews remotely. So a couple of things is, the camera level should be at your eye level or above your eye level. There should be no light behind you. The light should be coming in front of you. All right. So set up the room accordingly. You might want to put some couple of plants or something in, rather than having a blank background. Just saying, make sure that you set up everything. The webcam is positioned perfectly. Like I see a glare in your picture from the back because of the light. So you want that to be in the front.
Yeah,
so that
I'm not going to sit here actually.
No worries. That's the reason we are doing this, right?
Yeah.
So that I can give you feedback on how to improve these things. The light should be in the front. There should be no light at the back. So these are these little things that would make you look better. Your face wouldn't be dark, and yeah, just be very confident in whatever you're saying. Do just like step 2 CS. Sometimes you come across a patient you didn't expect, you don't know what to do, and you just start with your basic questions, and do the same thing if you encounter yourself in a tough situation. And for the other like typical questions, it's just like your step 2 CS exam. Okay. Just practice multiple times. The more you practice, the better it will be. And just talk fluently. You don't have to memorize or cram your answers and just give the same answer. It's okay, but at least have some idea of what you're going to talk, and practice it multiple times, just like having a CS exam, so that if somebody asks you a weird question, or if you forgot an answer, you can come up with another answer, in the middle of the interview. The most important thing, I think, throughout this encounter is to look confident, and you shouldn't look somebody who's shaky. Any questions for me?
I'm just writing down some points.
Well, thank you, Ms. Sara, for letting us do this.
Thank you so much. Got an idea of how this works. This is really important.
Well, I hope you all learned something from this video. If you did, please like it, share it with others, and subscribe to the channel. And like we always say, never give up, never lose hope. Bye.